Welcome to Pearls for Parkinson's. Here is this week's daily living tip. Welcome back. We are closing out our series on swallowing and Parkinson's disease. And today I wanted to talk to you about medications. Just like you can have issues with tremor or stiffness or slowness, some people have problems with swallowing that are dependent on the level of their dopamine. And so when their dopamine is low, they may have more problems with swallowing compared to when it's evened out and the dopamine is just right. So it's important to know that if you're having a problem with swallowing, to pay attention to your medication adjustments. If you're lowering your dose, has it been affected by that? If you're increasing the dose, does that help it? And those are information pieces that you want to take back to your provider. Also, if you are going to be having any kind of surgery and you do know that your swallowing is affected by your dopamine level, you'll want to talk ahead of time to your doctor and your surgeon about whether or not you're able to forego your medications in the morning of your surgery. So it's an important conversation to have. If you're having problems with swallowing, you may need to crush your medications and put them in applesauce or some other yogurt or something to get them down. If that's the case, you can't crush medications that are long acting. And sometimes those long acting medications are good because it keeps a steadier blood level of your medications. And so your swallowing might not fluctuate up and down. However, if you then need to crush it, it will lose that extended release capability and it'll become immediate release and therefore won't be effective as an extended release formulation. So it's important to know that you cannot crush extended release medications. Now, there are a variety of different types of medications that can be used for people who are having swallowing problems. There is patch formulation. There are formulations of carbidopa, levodopa that come in a capsule and can be sprinkled in like applesauce, and they still have immediate release and extended release formulations inside that capsule. There are also rescue therapies, meaning if you feel like your medication does kick in and wear off and you need something to kind of get you going again, there are rescue therapies that are injectable as well as sublingual films and also inhaled type medications. So it really depends on what's best for you. And that's a conversation you can only have with your provider. But I just wanted to make you aware that we're not just pigeonholed into one way of doing things. There are a lot of varieties of medications as well as ways of taking them. But the ultimate important thing is that you're paying attention to whether or not your swallowing is dependent on your dopamine level, and you make that part of your assessment. I hope you find these tips useful and you tune in next week for more Pearls for Parkinson's. The Wisconsin Parkinson Association is a grassroots organization funded by people like you. To support more local programming like this, visit wiparkinson.org.